Good evening, everyone. It's now 6 o'clock, so we will begin our reopening school virtual town hall. I'm Sal D'Angelo, Superintendent of the Chatham Central School District, and I'll be your host for this evening's presentation. This evening, unlike last week, I will not be joined by a panel of the school principals, the Director of Facilities, or the Director of Special Ed. They will be back with me on Thursday, and a little bit later in the program, we will mention the next opportunity for people to tune into the town hall meeting and to get updated information. So thank you for joining us. Tonight, we have, before we begin, I just wanted to remind everyone that we are being recorded, and the recording of this program will be available later tomorrow afternoon. So if you're not able to join us for the entire program, or you'd like to review portions of it, you may do so by following the link on our website. Or if you'd like to recommend a parent or a family member to view it, they'll be able to access that as well. I mentioned before, thank you for joining us, taking yet again some more time out of your busy schedule to learn more about how Chatham is going to reopen schools safely in September. The objective tonight is following what we've done in the past. I'm taking into account that we may have some viewers who have joined us in the past, and then some who have not. So for the benefit of those who are new to this town hall meeting, I will take some time to do a little bit of a review, a little bit of an overview, and then I'll go on to some new information that we've added as of late last week, and then we'll get to some more questions that have been submitted through the website or through the email that we've established, and then certainly live questions that you might ask this evening. And I just want to bring up, there we go. All righty. So how did we get here? So the state had given us guidelines. We formulated a plan which we released to the public on Monday, August 3rd. Please keep in mind that as we have said all along, flexibility is going to be key going through this, that even though we released the plan, what is now 2 weeks ago, things are changing and continue to change on a daily basis. And that's why it's important for you to check back in and follow our communication so you can see what's different from the last time that you may have seen some of our communications. We will review also an opening schedule that I shared with you for the first time last week. Talk a little bit about the components of that schedule. We've added some additional information based on some feedback and some concerns that were brought to our attention. I will share that with you. And as I said, we'll answer some questions as well. If you would like to see the entire plan is available on our website. If you go to our home page, about midway down the page, you're going to see an icon that says coronavirus. That's going to take you to a sub-page that's going to have all the resources that we have published to date regarding the coronavirus, our response to it, and our plans for September. On that page, you're going to see 2 documents related to the opening plan. You're going to see the multi-page, close to 40 or 50-page document that outlines everything that we were required to do for the State Education Department and the Department of Health. And then we also created a shorter, more executive summary version of that plan called a snapshot, which you will see is a 2-3 page document that highlights some of the items of the master plan. Since then, this past Friday, many of you should have received a communication from me pointing you to some additional resources that we've added to that page. In particular, we have now added, we were referring to it as a frequently asked questions document, but we decided that it didn't matter whether it was frequent or not. We wanted to make it a questions and answer document. So there is now a resource there called Opening Question and Answers, and we continue to update that, and we'll update that on a regular basis as more questions come in through either that Chatham United email, and we're going to share that with you again on a slide later in the presentation, or they are emailed to us or in conversations with stakeholders. The other 2 documents, which the governor had required us to post by last Friday, are a contact tracing document and a COVID-19 testing document. And we're going to go over those tonight in this presentation, because that's new information that we have developed in collaboration with the Columbia County Department of Health. And I think there's some very important information in that, as well as information that will answer some previously asked questions. And so those are available on our website as well. Just kind of a refresher, the plan addresses 13 areas that were identified by the governor, the state education department, and the Department of Health. And tonight we'll go over some of the priority items within this document. We won't review every area that's indicated here. One of the key areas of that document is our health and safety guidelines. So I want to spend just a few brief moments talking about that and adding some additional information that's highlighted in yellow on your screen. So first of all, as I reported to you in the first town hall and then updated you last week, parents will be asked, one of the things that I hear all the time is, how can we help the district be successful? You've heard me talk about this is going to take a village to get through this. Well, one of the ways that parents can help us in a very big way, and there's going to be a few tonight I'm going to mention, but this is one of them. The basic premise is, if your child is ill, please keep them home. And so we are required for parents to do what we're calling health checks. We're going to be using an online self-check program, which is going to ask whether your child is experiencing a 100.0 degree temperature or more. It's going to ask you some of the standard questions you've probably been asked if you've gone to your primary care location, which is, have you traveled outside of New York State? Have you gone to any of the, within the last 14 days, have you gone to any of the states that are on the list? Are you exhibiting any of the symptoms known to be related to COVID, et cetera? So by answering that, you're going to help us process the kids into the school buildings much quicker in the morning, because that program will generate an exceptions list, and then we're going to have to spend time, precious time, taken away from instruction in the morning, processing children that have not cleared through that system. So check that off as one way that you can really help us out by performing that health check every morning before you either bring your students to school or put them on the bus. We know that we know a few things about COVID since it's hit us in March. We know that healthy hygiene practices are essential. Our safety plan will include videos, instruction, proper signage. We're in the process of putting signage in the next week or so in terms of proper social distancing, directions in hallways and in main offices, and even outside as students enter our property. For the purposes of the discussion, I wanted to define social distancing. I think I might even called it social or distance learning last time for some reason, but social distancing is defined by 6 foot separation between individuals or an appropriate barrier between individuals. We will talk a little bit more about those types of barriers. We are required to use polycarbonate products, not plexiglass products. And in places where we think we can get a couple students together for a therapy situation and properly keep them safe in terms of using barriers, we will do that. So a mask, a barrier, or social distancing are kind of interchangeable. I'm happy to report that the PPE, a new term that we've learned through COVID, right? If you weren't in healthcare, you probably didn't know what that was, stood for 7 months ago. But PPE, face coverings, shields, gowns, gloves, anything related to personal protective equipment, is starting to roll in. As you may or may not know, the governor, the state education department, requires that we provide masks for students and staff. One question that I get is, can students come in with their own mask? Yes, if you have purchased some 2-ply cloth masks that you want your students to wear, that's perfectly fine. But we will have both cloth masks. We're purchasing a minimum of 2 per student, so they can be laundered every couple days. The Department of Health recommends that they be laundered no less than once a week. So if we give you a couple, we should be able to keep up with that. And we also have a huge supply of disposable masks. So if a student should should forget a mask, or and that might mean before they get on the bus, or when they get in school, something happens. We do have a large supply of disposable masks, so no problem there. Management of ill persons, we're going to talk about that a couple times this evening. We have protocols and isolation rooms that are being identified in each of our buildings as per our requirement and as part of our plan. This is where I want to pause and tell you that when a child needs to be sent home, so they're exhibiting perhaps a temperature during the day or one of the other COVID symptoms, it is going to be imperative that a parent or a representative of the parent who's in our student information system, we can't just send anybody, we have to know who we're sending our students home with, will pick up their child as soon as possible. We're really hoping that we have a goal of no more than 30 minutes. So what we're asking, another thing, here's number 2, you can think about as this year goes on, if you have opted for any in-person or hybrid where your student is going to be on campus here, we do ask that you also have a plan, should you work during the day, that if we call you, you're able to pick up your child. I know that's a little bit different than in the past. In the past, we've had grandparents and other people on that list pick up children, but because of COVID and the fact that perhaps older adults are in a high-risk group, you may have to give that some thought in terms of who would pick up your children. Also, a note that the nurses wanted me to pass along to you is during the first few weeks of school, if you would email the school nurse, and if you don't have that, you can find that contact information on our website. But any student that would traditionally have medications in school, the nurses would love you to call, make an appointment so that you can arrange to drop off any medication that your student may need while they're here. And so please note that students receiving medications in school must have a new medication order written annually. So you may have had one in place last year, but you do need to have that updated. And then when we, in terms of cleaning and disinfection, I'm going to just say a few comments there. Andy Davey, our new facilities director, was with us last week and spoke. He's the person who supervises that department. He spoke in terms of very great detail how we've purchased ample supplies of the proper cleaning solutions that are on the FDA list of safe but yet effective cleaning solutions, and our strategy in terms of how we will clean our buildings adequately every night, keeping very detailed logs and keeping those on file as well. I did have questions in terms of, well, do you think we can do an adequate job? And some school districts are having an off day. We feel we need to clean the building sufficiently every night, in addition to our custodial and maintenance staff cleaning high-touch areas throughout the entire day. We already know that push bars, doorknobs, railings, fountains, anything that students might frequently touch need to be cleaned several times a day. And in the evening, our classrooms and other areas will have to be thoroughly cleaned. And because we're not having any activities right now, there's no co-curricular activities, there's no utilization of the building beyond the instructional day, we really feel that our maintenance and custodial staff will have sufficient time to spend making sure that our building is clean and disinfected. Let's talk a little bit about masks. I've moved this slide up considerably in the presentation from last time. Two town hall meetings ago, we talked about developing some mask rules. Last week, I shared with you this current thinking in terms of we are one of the districts in the Questar region, there's 23 of us, who firmly believes, and it's the majority of districts, that to every extent possible, our students should be wearing their masks. Masks are required on the bus. They're required in the hallways, in all areas of the building. They're required in the classroom. We do understand that our students will need a little bit of a break from them. We've designed this schema, if you will. And right now, we believe that this is a good model, but we're open to listening to feedback. Right now, students would be given a 5-minute break approximately every 30 minutes at the pre-K to 5 level, and 5-minute break once a period at the secondary level. Students are not required to wear a mask during lunch while they're eating, as long as they are, and in all 3 cases, a break cannot occur unless students are seated, properly socially distanced, with the teacher participating in that as well. So that's where we currently exist with our mask policy and our breaks. We're going to try to, we're an education facility. I said it last week. We're going to try to take a very educational approach to it, trying to share with our students their social responsibility, the motivation behind why we wear a mask. Wearing a mask isn't necessarily to protect us, but it's to protect others. And so, by wearing a mask, they're protecting their parents, all of you, they're protecting their grandparents, they're protecting their friends. And so we're hoping that in one way will be an intrinsic motivation for them to cooperate. We understand that some of them are young to understand that, and so we'll have to do our best in explaining that at an age-appropriate level. However, I want to be clear that this is, and there's a typo there, sorry about that, this is a public health crisis, and masks are a very important part of our ability to stop the spread. And so as such, someone who is not in compliance or even disruptive, maybe pulling someone else's mask off or doing something counterproductive, we will have to consider disciplinary action. So that's a little bit about our masks. We've talked about facilities in the past. Again, I did mention that our signage, both interior and exterior of the building, Andy and his crew are working on that. I will touch upon a little bit about ventilation, because that seems to come up quite frequently. And then I'm also going to show you some pictures that I've shown you, I believe on both occasions, about just to give you some conceptual context for what our classrooms would look like. We know that part of bringing our students back, it's going to be very important for them to understand what their new normal, if you will look like. In terms of ventilation, Andy, at the last one, and he'll be back on Thursday, explained that we are very fortunate that through some of the recent capital projects, many of our HVAC systems have been replaced and are new. And the good news there is that those systems do allow us to use better filtration. I don't want to get too much into it because I'm not the expert, but basically, you talk about MERV filters and sizes and stuff like that. The new equipment allows us to use some of that very sophisticated filtration. That's a very positive. And in all cases, one of the questions that I get, because people are familiar with some of our rooms in the district, including some on the interior of the high school, they have very small windows close to the top of the room. And people are wondering, how do you get proper ventilation? Well, ventilation is not just a function of the windows in the room. Ventilation and proper fresh air being exchanged in the room is more of a function of how the systems are set up and how the air is being exchanged through the heating ventilation system. So rest assured that we have, Andy has looked at some of the percentages and the settings, and we are going to increase airflow, fresh air into the rooms as much as possible. Now that's a little bit easier said than done in the summer months than in the winter months, but certainly they are taking a look at that. So we are looking at air filtration and air exchange as part of this plan. Here are just a few quick photos of the different classroom configurations that you'll see in all 3 buildings. This is what they look like when we start to provide proper distancing between the different desks. And here's one from the elementary school where it's more of a table model. I'm going to touch upon a couple areas that I've touched upon in previous presentations by way of really no new information, but if you haven't been with us, our child nutrition program is in full effect. So those students who receive free and reduced lunch, we will be continuing that. We would be doing that in a very discreet way. We are required to do it in a way that does not distinguish those students receiving or shaming students receiving free and reduced meals. Our food service director, Barb Murray, is wonderful in designing this program, which for the most part, at least at NED, the elementary school, will probably have students eating in their classroom. We do have the cafeterias, and we are looking at how they can be potentially utilized in a very limited manner. We do know that if students do eat in the cafeteria, they will need to be properly socially distanced and take proper precautions in terms of cleaning. In terms of allergies, Barb is already working on those students who have food allergies and how we are going to facilitate making sure that they are protected, and students within a classroom or close proximity or whatever those requirements are understand that where a child may have an allergy to peanuts, for example, that other students, whatever protocols we need to make sure that that student's protected, we will do that. She is examining that right now. Transportation, again, no changes from the last time we spoke, although to just reinforce the fact that we did have a transportation survey, and with the parameters that all of our students must wear a mask on the bus and will be distanced as best as possible. We had about just over 60% of our parents who were eligible for transportation indicate that they were comfortable in sending their children in that scenario. I do want to mention that that survey also asked if you were willing and able to bring your children to school, because one of the ways that we are able to do K-6 in person is if we can adequately transport everyone to school. We may ask another way that the community can help us is if you are willing and able to drop your student off at school and we are kind of reaching our capacity in transportation, we may reach out to you and say, if it's at all possible, that would be very helpful for you to do that. And so more to come on that as our numbers come in between who is selecting in person and who is selecting full remote. We're getting, and that's really one of the other justifications for having to have you make that selection. We'll talk a little bit more about that in a minute, was to be able to design some of these programs with real data in mind. So transportation, more to come. I'm looking down at the slide, and I remember one question from several weeks ago, and that is hand sanitizer cannot be used on the bus because it is flammable, it's combustible, and DOT regulations do not allow us to, which would be, you know, maybe a logical or an obvious choice to have kids put some hand sanitizer before they get, or right as they get on the bus. We can't do that. That's transportation. Let's get into some school schedules, and you know, we've been talking about this for a few weeks now. We keep kind of converging in on what the beginning of the school year will really look like. There's still some details that are under consideration, under design. We appreciate your patience and understanding. I know that comes with perhaps some frustration. We've asked parents to make some decisions with not necessarily all the information that you normally would like to make a well-informed decision. I know some of it is very difficult. I've had conversations with many of you, and I understand that. I hope you understand our position. I've referred to it maybe way too many times as the chicken and the egg. We can't properly plan for what it should look like if we don't know who's firmly committing to it, and vice versa. So I understand, and I'm sympathetic to that. So school schedules, we've evolved over a few weeks, month, in terms of conversation. We have landed on the ability for us to deliver a full pre-K through 6, but I'll talk about it in terms of elementary school, full pre-K through 5, in-person, 5-day-a-week schedule. When we first started out, we didn't believe we had the additional capacity. We began with a hybrid model at the elementary school, but we quickly started thinking about two downsides to that. One being they are our youngest learners. So from our experience in the spring, that's the toughest population to try to educate remotely. So for the purposes of providing them the most appropriate learning activities, we decided that it made more sense if they were here every day. And also that's the population where it's very difficult for parents to have childcare. So by them coming to school and us figuring out how we could properly socially distance, and I'll tell you how we're doing that in a moment, we would bring everyone who wanted to come back at pre-K to 5 in person, in addition to special education E&L in those grade levels, bringing everybody back. What we're doing in a model is that we've kind of spread out in the building. For the most part, our classrooms can hold somewhere in the vicinity of anywhere from 11 to 15 students. We have a couple rooms that are large enough to hold 15 students. And we believe that there might be some sections within the building based on people who are selecting remote instruction where there might be, we may have the ability to put the entire class together in one classroom. And in that scenario, that classroom would be all together. They would have their classroom teacher, and things would be as close to normal as normal can get right now. However, in sections where we might have 22 or 23 students in a particular class, that class will be split into 2 parts, and that classroom teacher will go either electronically between both rooms or in some cases physically between both rooms. And of course, the balance of the time for which the teacher is not in one of the 2 rooms, there will be adult supervision provided by perhaps a teaching assistant or a classroom aide. So that's how we're able to manage the full in-person instruction MED. But also because of parent, I'll say parent demand, parent interest. Several weeks ago, districts in the Capital Region, districts in Questar Region, districts in Columbia County started to realize that parents were requesting that we consider how we would offer a full remote option. And so what we did is we've designed at the elementary level, we believe, and again, another reason why we really needed your commitment to better understand this, but what we're going to be able to do is we believe we're able to take some resources and dedicate them to full remote instruction sections. So in terms of where we traditionally might have 3 second grade in-person sections, we might have 2 in-person and 1 remote. And so a resource, a teacher, will be dedicated to teaching just the remote session. There is probably a little bit of an asterisk there, and that is I'm asked quite frequently if I committed, and we did ask you to commit, and we'll talk a little bit about the deadline being today, to full remote instruction. We are asking you to commit at the elementary level for 1 trimester and at the secondary level for 1 quarter. If something were to happen that you needed to come back in person, we felt that the student was, it wasn't working out, and the school counselor, the school principal, and we all have a conference with the parent. What I wanted to mention is that your student coming back in person may not be coming back to the same classroom necessarily as the remote instruction. So I want to make sure people were aware of that. Looking at the middle school, we felt grade 6 would be handled very similar to pre-K to 5. That has been designed as a 5-day model. Our 6th graders will come back to the middle school for 5 every day, Monday through Friday. I don't want you to misinterpret my next comment. We are still working out details, not only grades 7 through 8, but grades 7 through 12 on how the hybrid would look. It's still going to be hybrid. It's still going to be alternate day, but we don't know whether it might be 2 days on and 2 days off, only because we're trying to fit in as many courses and as many electives, as many encore programming that we can. And so if you follow a traditional high school schedule that a student might have followed in the past before COVID, there was already an AB schedule where those courses that didn't meet every day met every other day. And so we have a little bit of a challenge when you're dividing the courses up. How do you facilitate that? So the team, Mr. Burns, Mr. Stead, Mr. Thorson, and Mr. Forrest are working with the school counselors, Jim, Amanda, and Jackie, to figure this all out. But I don't, and I know that's a little bit frustrating because you would like answers. We're only a few weeks away from school starting, but we will continue to work over the next few days on that. And then there's also, full remote at the middle school and full remote at the high school. And we continue to work with our Teachers Association on how we will facilitate that. When I first introduced the fact that we would have a full remote option, we are part of the QuestStar Consortium. They are coincident to our plan designing what they believe to be an academy model. We have not discounted the fact that we may participate in that program, but I've said all along that our preference is to have Chatham children taught by Chatham teachers. And if we can manage that, that will be our preference. But I don't, at this juncture, want to totally discount the fact that we may have to plug into a larger system that has more resources that are coming from multiple districts. And at this point, I just can't say that we can exclude that as an option. I did want to make a note about CTE. CTE is running as scheduled. We participate in the QuestStar CTE program through the Hudson location, and that is taking place 5 days a week. The buses will be running, transportation is facilitating the buses running both AM and PM to the CTE facility in Hudson. One of the questions that I've been asked on a few occasions this last week or so is what happens to our students either when they get back from an AM program or what happens to them in the morning before they go to a PM program. In the past, they would just simply be attending school, but conceivably, if they're in grades, or they're in the high school, they would be following a hybrid schedule. So, what happens to those kids on the day that they're not scheduled to be physically on campus? We still need to figure that out. We are constrained. I've said this in the past. We're constrained by facility. We're constrained by staffing, and we're constrained by the social distancing requirement, which kind of relates to capacity, in that we would love nothing more to have half of our 7 through 12 population, all of our special ed population, and our CTE students in the high school. But to date, we haven't been able to figure out how to get everyone in the building at the same time. So we're working on that. More to come on CTE, the balance of CTE. A week ago, on the 10th, we, in anticipation of parents helping us decide or helping us understand whether they wanted to select remote learning, we came up with the remote learning request form. That the deadline for submission is today. If you haven't sent it in and you're still considering remote learning, that's not a problem. Today is not over with yet. I assume that some people would want to view tonight's webinar before they made a final decision. If you get that in later today or even by tomorrow morning, that's quite all right. But we do need you to fill that out if you are one of the parents who would like to commit to full remote learning. I'm asked all the time, let's think about and take a moment, this will answer some of the questions, 2 scenarios. What happens if I commit to full remote learning? Well, what are you committing to? You're committing to, at the elementary level, 1 trimester. Let me look at my notes here. That goes to December 3rd. And if you're committing up to the middle school 7 or high school, you're looking at committing to November 15th. Well, what happens, I mentioned this earlier, if for some reason remote learning is, and I hate to use the word disaster, is just simply not working out, then parents or partners in this, you contact your building principal, your school counselor, and we will have a conversation to see what we can do. Remember, we are constrained by capacity, so the reason we're being very guarded is we will design these programs based on whether people committed to remote instruction or indicated they want to send their students in person. So with that said, we may be maxed out in a grade 2 section, and bringing a student back in may be very difficult to do in that time period. So please understand that as much as we would love to be extremely flexible and have people fluidly move through the plans, that may not always be possible. We also have to take into consideration, we're going to talk about a little bit more, is what happens when somebody is quarantined or ill and has to go from an in-person to a remote model. We need to have some flexibility in moving those students in and out of the program. let's talk about the people who have selected to send their children to school. I understand, it's not an easy decision. And I know students, all of our students want to be with their friends and classmates. They're all very social animals, if you will. They miss their friends. And I'm sure they're putting a lot of pressure on you to, in some cases, send them back when you may not feel totally comfortable, right? They feel invincible, and we want to protect our children. They're our babies, right? We don't want to see anything happen to them, and nor do we, right? The administrators and myself as a superintendent, this whole situation has provided us with great trepidation on what we do to make sure we keep our students safe. But if you have selected to send your kids in person, and that ends up being something that's not working out, we're willing to have a conversation in that regard too. And in some cases, it may be a little easier for us to go from an in-person to a remote model, but maybe not everywhere. But so again, we want to work with you. Please understand that we can't work blindly without any information. Just a couple other things that I've mentioned in the past. We've already talked about our special needs population, our ENL students, other students that fall into what we call a vulnerable population. What I mean by that is, and I kind of alluded to it, but if we have a student who's had selected remote instruction, and teachers and or school counselors are just not seeing that student be successful, we definitely plan on having a conversation with you. I've asked about the 180-day calendar. We have no choice. That is something that comes from the state education department. Our school year will be 180 days. I know we're going to go talk about the calendar in a minute. Learning starts in Chatham on September 14th. We're going to talk about what that looks like, but and because we've moved some professional development days up front. But learning officially starts here on September 14th, and it will go, unless something changes, and that would require a dispensation from the governor or the state education department or both, that would go until June 26th. Of course, the high school level, and I'm asked this as well, we have no idea whether there'll be state testing or regents at the high school level or grades 3 through 8 testing. That is way too early to even have that conversation. Just know that to some extent that's the 3 through 8 testing schedule is outside of the state's control. They receive a lot of federal funding that's tied to accountability, and they're going to wait, just like we will have to wait, to see if the federal government, like they did last year, will give them a waiver from a testing assessment schedule, and then that's typically what would happen in not having the test. We can certainly make an educational argument for this is yet another year of disrupted education, and that testing under these circumstances may not make or yield information or data that's actionable. So there's a lot to be, and again, same with the regents, we just don't know. But if they occur, then high school might end a little bit earlier to allow for the testing. It's way too early. I got this question asked last week. If everything goes like we planned, this past year, even given COVID, we had graduation on Friday, last Friday in June, and next year it would be like June 26th. But we're just trying to get through the opening, right? Attendance and absenteeism, I've mentioned this before. Unlike the spring, and we know nothing can look like the spring in terms of what our remote program looks like, and one of those things are attendance. Attendance is going to be required daily, whether you're full remote or you're in person. We are going to be tracking attendance, and it is an expectation that students are engaged in learning every day of those 180 days. If a student was in person and is now home ill, or is under a precautionary quarantine, or is even under a quarantine for which they're not physically ill, and are participating in remote instruction, that wouldn't be considered an absence. However, if a student, for whatever reason, just like in the past, has a stomach bug, has strep, or just isn't feeling well, you'll be communicating that with the school, and that would be like a regular sick day. We don't want students to have to feel like they're not feeling well and participate in school. A little bit about the sports and extracurricular activities. No new information. I believe they're meeting again this week, but the way it, just a quick overview or a quick update, not update, a quick review, I should say. Right now, there are two proposals. One, a delayed start that would have fall sports starting on September 21st. And another one, if that is not allowed by the governor, then another one that contains a condensed schedule where they're taking winter, then fall, then spring sports and putting it in a time period compressed between January and June. There would be some overlap between the different seasons, so for the multiple season athletes, that might be a little challenging. One question that I have received, and we've answered, I believe, on the frequently asked questions, whether a student has selected or their parents have selected full remote or in person, that does not preclude them from participating in sports and any extracurricular activities if and when they return. So if you are full remote and sports return and you're on the basketball team and you would like to play, you're welcome to participate in sports. I'm going to talk about childcare a little bit more when we talk about the opening schedule, because that's a large concern and feedback that we got from the last town hall, but hold that for just a moment. Immunizations, as I mentioned last time, regardless, this is not us, this is New York State Education Department, regardless, again, whether you're full remote or you're an in-person student, your immunizations must be up to date. Now, we know that that law changed over a year and a few months ago, and parents had to commit to a catch-up schedule that was prescribed by the CDC, and then COVID came along, and for a few of you, that was difficult to get appointments, and I know our nurses worked with you to try to get new appointment dates so that you could satisfy that criteria. But I wanted to be very clear, and as I joked a little bit about last time, you don't want to receive a nasty little letter from the superintendent excluding you from school, because it doesn't matter whether you're remote instruction or in person, all immunizations have to be up to date, or we need to have a documented, I believe we can accept a documented appointment in the short term, but you need to be up to date very soon. And just a note here, because we get this question a lot, the spring, you need to kind of put in our rearview mirror. Any remote instruction that takes place moving forward will fully have grading and assessments and expectations for grading as part of the remote instruction program. So I kind of surprised some people with this last week. We developed this just before last week's town hall. I know I surprised a few staff and a few community members, but I want to talk a little bit about this because a lot of thoughtfulness went into this. And you may have seen in the news recently that a number of schools in the area are starting to look at changing their strategy in terms of when students physically come back to school. So let me add a little bit more context in terms of this plan. School traditionally starts the Tuesday after Labor Day. And in a typical year, we either have one. Last year, for the first time, we had 2 conference days up front, and students return to school on Thursday of the week of Labor Day. This year, almost unilaterally across the region, including the capital region and north and even south of here, I believe, we realized how much work we have to do with our teachers to make sure that they are comfortable with the different models that we're implementing when your children return to learning. With that said, and in all fairness to the teachers contractually are not obligated to work summers. And so we had to work around the contractual year. So we've moved all 4 conference days up front, and those 4 days, with little exception for some mandatory training, some building meetings, and a little time for them to get their physical rooms ready, will be predominantly filled with training related to providing remote instruction. They did a wonderful job. Our teachers, our teaching assistants did a wonderful job in pivoting in March, but they did so on a dime. And now, and many of them have participated in professional development in the spring and throughout the summer, but that's voluntary on their part. Now we're going to make sure that they all have the same access to quality professional development. So that brings us to Monday the 14th, which a lot of districts locally, that's the first day that they're inviting students back. We have been discussing with all of you for weeks now the myriad of items and details that need to be figured out and decided upon. And there, every time we think we have a good solution to something, it's like a system. We poke it here and it pops out there. It's like whack-a-mole, right? You pop it down one place and you solve a problem and a new problem pops up. I don't know if there's any great solutions, but because it seems like every time we come up with something, there's always an upside and a downside to it. So I think what we have to find is the solution that has the most upside to it. We really felt that we did not want to rush students back in the building. Now listen, I know the downsides. I can't imagine envisioning, and it's a long time ago, when I went to school each year, the excitement I felt that next school year meeting my teacher for the first time on opening day. Unfortunately, there's a lot of things that are different in this era, right? We hold on to those strongly held traditions and things we're comfortable with, but there has to be some trade-offs. And we feel that by taking our time and bringing the students back, and if you're full remote, this has less of an impact on you. But if you've selected in person, bringing the students back will allow us to better prepare for a successful opening. And let me give you some additional information in regard to that. So first of all, there's one caveat to that. The week of September 14th through the 18th, that whole week, Monday through Friday, we will be in contact with you. If you are a incoming kindergarten parent, we are going to bring in your child on one of those days by appointment. We will, the MED, the secretary, Kristen Reno, and Brett Fortran, our assistant principal, one of them will be in contact with you as to when we would like you to bring your child in so we can do what was typically done in the spring, which is kindergarten screening. That's a very important part of the process in properly placing your child in the right educational environment when they start school. So with the one exception to all students being remote would be the kindergarten students the week of the 14th. As well, the second week, the 21st through the 25th, we will have all pre-K and kindergarten students in all the week. So when I say that we are full remote, it's with those exceptions that I've just noted. So when we looked at that, we said, wow, what kind of hardships are we creating? What kind of difficulties for parents are we creating? Well, the obvious one is for anyone who is expecting their students to start on the Wednesday or Thursday after Labor Day and even the Monday, the 14th, you're probably pretty shocked to know that your student is going to be remote for at least a couple more weeks. Well, and why? Well, for some of you who work, whether you're a single parent or multiple parents in a household, and you both work, you have problems with childcare. And so I don't have all the details worked out for you to give you tonight. It's part of our planning session tomorrow, but we are committed to providing I'm not going to call it childcare. I'm going to call it learning support, and I'll tell you why. Students will begin learning, as I said earlier, on September 14th. And so what we would be providing those 2 weeks is an opportunity for students who are not able to stay at home to come in here, to be in one of the classrooms that's available, to be supervised by potentially a teaching assistant or a classroom aide who will to monitor them or supervise them while they're doing the same thing that all the other students are doing at home. So that helps you as a parent solve the issue that you would potentially not have someplace for your students to go or someone to watch them during the course of those 2 weeks. We're also working very closely with transportation, and we preliminarily feel at this point that we would be able to provide transportation in those 2 weeks as well. So we'll be able to, probably by Thursday's town hall, and certainly I don't expect you're going to watch each of these every time they're on, but we will also communicate that with all parents that we're able to provide some sort of learning support during those 2 weeks. I've been asked, well, why? Why do you need to do that? Well, the teachers will be experiencing professional development those 4 days, but that's not where it ends. Those next 2 weeks, and our classroom teachers will be providing remote instruction, but during their common planning time and other opportunities during the course of the school day where they're not engaged with the students at home, that gives them an opportunity to have team meetings, to have grade level meetings, to talk with colleagues, so that we are really fully prepared to be successful when the students come back. And how are they coming back? Well, this has always been the plan, at least in Chatham. On the 28th, we're going to slowly bring back small cohorts of kids, students, 1 day at a time. That will give us ample opportunity to work with smaller groups of students who are coming physically back in the building and who are coming back into a world much different than when they left. We're going to, whether they're coming into the building, they're navigating the building, the hallways, the expectations in terms of the classroom and social distancing and common areas, proper hand and respiratory hygiene, all those things that will perhaps have been introduced or discussed during the remote only time will now be practiced for real. And so that would be the week of the 28th through the 2nd. And I know it's hard to believe, but then we would be in the first full week of October. And October 5th, that's when students on that day will be in the mode that they had originally selected. So for the full remote students, they continue to learn online at home. And for the in-person students, they start that schedule pre-K to 6 every day. And at the high school, middle school and high school, again, we're finalizing what that might look like. But those students who have selected in-person would have some sort of hybrid alternating schedule. An idea came about yesterday or this morning in terms of, are we able to get around the other issue that I mentioned where students would love to meet their teacher. So because someone had suggested that, we're going to discuss tomorrow that maybe we can have a properly socially distanced meet and greet. I don't know what that looks like. We're again, we're really trying to listen to what your feedback is, and to the best extent possible, take that into consideration. And so we will talk more about that tomorrow. And then again, I mentioned the tri-semester and the quarter dates. About 2 weeks prior to those dates, we will ask parents. We're going to assume that if you are in a full remote model and you're happy, then you're going to continue in it. But if you want to consider, if things go well and the infection rate stays low and in-person makes you feel less apprehensive, you will let us know that you may want to switch at those commitment dates. Okay, I mentioned earlier that this is a slide from earlier, but I wanted to go over a little bit more in detail because this answers a lot of questions that have come up in the past few weeks. We added, remember, 3 new resources: the opening Q&A, which we continue to add to, and thank you for all those folks who have sent emails to Chatham United. We're going to flash that at the end of the program, so you're aware of that email address. But I want to talk a little bit about the contact tracing and the COVID-19 testing, which was documents that the governor had required that we post. And those documents are documents that were primarily developed by the Columbia County Department of Health. We had some input into them, but we're really taking our direction from them, and I'll go over those. So the 3 documents, this is just a screenshot from that page, the reopening questions and answer page. Again, if you have a question, I urge you to take a peek at that because chances are, if you're thinking about it, someone else has, it's there, and the whole intent and purpose of that is so that you don't have to wait for a response from us if somebody has previously asked it. There are a few questions in the pipeline that we haven't posted yet because we perhaps need to put a few more details to them. And so if you did send a question in and you don't see it in the questions and answers, it's probably because we're waiting for some additional information or clarification on it. I know one example of that is we had been asked, can students bring in their own hand sanitizer? And we were questioning where the guidance was, what the guidance position of that was, and we had a little discrepancy there. And so we went out and sought information from our health and safety specialists at Questar and others. And if it didn't go up today, it would go up tomorrow. But the answer to that is we discourage that because, as you know, or may not know, many of those products have been recalled. And so having a product, not being able to control a product in the school is problematic for us. Some have fragrances that students are allergic to, others have been recalled. And so to avoid all of that, we will provide plenty of hand sanitizer. That doesn't seem to be a problem in terms of resources that we can get access to. So let's talk a little bit about, I think there's a couple slides on COVID testing. A lot of you have asked, like, what's going to happen when some of these conditions take place. So, and I'm going to refer to the document a little bit because this is somewhat new to me, and I don't want to misspeak on something. And I apologize if I dislike when somebody reads something that's right on the screen to you. But in the event that an individual is showing signs, we're going to send them to the school nurse, and we now have isolation areas earmarked or identified in all 3 of our buildings. We talked about asking students to be picked up immediately, as making a plan in the back of your mind should that situation occur, who might pick up your student. Staff, if it's staff members, we're going to ask them to leave immediately. Individuals are referred to their primary care physician for evaluation. We know that it's not all going to be COVID. The student may have a fever because of strep throat or some other medical condition, but we're not medical professionals and we can't evaluate that. So you are going to be asked to seek medical evaluation. You're going to call your primary care physician, and they will work through that with you. They may say, that sounds a lot more like strep than it does COVID. Come into the office. And my understanding is if they're able to identify, so with certainty, eliminate, identify that it's strep through a strep test, that they may say, well, then here's the course of treatment. Student goes on potentially an antibiotic, and then I will give you a note to return to school in X number of days. So if it's non-COVID related, that's pretty much what's going to happen. Any symptomatic student or staff awaiting testing results. So in the case where the doctor says, you had a fever, there's a cough, there's some other signs that you lost your taste or smell, some of the things that people have identified as being related to COVID, they may advise you to get tested. We're going to show you some testing sites. And my understanding in conversations with the Department of Health is that testing results can vary. If it goes to the state lab, it could be as little as a day or 2. If it goes to one of the national testing centers, I've heard stories up to 10. 10 days waiting for test results does us no good. But anyway, I've highlighted this in red. Self-quarantine and will not be allowed to return to school until released by a negative test. And that's a little bit controversial because in speaking with the Department of Health last week, the number of tests they have available to them is somewhat limited as well. But if an individual is confirmed as a positive case, isolation protocols will be required. And pretty much that whole process is going to be managed by the Department of Health. And at the end of the day, no one, staff or student, can return to school without a release letter being provided by the Department of Health. And there's some other information in terms of how you will be notified. We're asking that if parents find out before we do, the Department of Health will know for the most part what school district the student belongs to, but if you find out before we do, we ask that you let us know. And in the event that a student is under mandatory quarantine, we will make whatever arrangements we need to provide remote learning under that quarantine. Here's just a glance at the testing sites that were provided to us by the Columbia County Department of Health. There's some throughout the region. Hudson, Kingston, Colony, Galatia, Latham, and certainly SUNY Albany. That's just a reference for your convenience. Continuing with testing, in the event, I'm sorry, I went backwards, sorry. School closure. This is unlike in the spring where the governor put some guidelines in place that if a positive case was in a school, the entire school had to shut down for 24 hours, and then the school would work with the Department of Health to determine the next course of action. That's not necessarily the case. They're not immediately going to go to a school closure this time. The school district will work with the local health department to determine close contacts. It may very well be that the student was dropped off to school by a parent, so they weren't on a bus. They only had incidental contact in the hallways, but they were predominantly in a classroom and maybe a bathroom. And it may be that that classroom is shut down, and the teacher and those students are put into quarantine. Now that's certainly going to be challenging, but that's where the whole school would not necessarily be shut down. Now you can kind of extrapolate and say that, you know, after a number of those, there probably will be a demarcation where we'll have to consider an entire school closure. If we don't have students, and more importantly, don't have teachers to teach in the classrooms, we may be forced to go to a full remote scenario. But in terms of just the higher level view, I wanted you to know that that's what's different than the spring. We would not go to an automatic closure. Let's talk a little bit about contact tracing. Again, this is a function of the local health department in collaboration with us. You know, we have high school schedules. We have the product that we're doing the self-check. We have some hope will do some contact tracing for us, but we will be the ones that help the health department put together the list of contact information of those people that they would need to contact to potentially ask to voluntarily quarantine. And please understand, I mentioned this last time, confidentiality must be maintained as required by law. School staff should not try to determine who is to be excluded from school based on contact without guidance of the local health department. And then you can read through this at your leisure, but at the bottom, any contact identified by the health department may not return to school until such time that they are released from the health department, and the health department will provide us with a note, return to school no. That's a little bit of updated information in terms of COVID testing and contact tracing. That is all new since we last met. Before we get to some questions, just today from 2 to 3, I was not able to join them, but John Thorson and Mike Burns, and I assume maybe the assistant principals, and 30 some odd students had a forum. My understanding is the students again asked some pretty insightful questions and got some information from their school principals. It was, by all account, a very valuable experience. This was the second one, and I was also informed that they are planning more before the start of school. So we will make sure that as of last time, not only do the students get the email, but we let parents know so that they can encourage their students to join them. These are not public sessions for privacy reasons. We do have recordings, and on a limited basis, we'll make them available to a student or to a staff that wants to hear the questions, but they are not publicly available for privacy reasons. Just a word about when we're doing this next. This is our third town hall, but it's the second in a sequence of 3 that the governor, and again, I said this last time, the governor mandated that we have 3, but that isn't the reason why we should do it. And I assume that this won't be the last one either as we get closer to the start of school and more information becomes available. But we are having 2 town halls, one exclusively for staff on Thursday at 10 a.m. That will be a town hall for all school district employees to ask some of their questions and learn more about our opening plan, as well as that will be recorded and be made available to employees only who can't make it. And then that evening from 6 to 8, the school principals and the facilities director will join me like they did last Wednesday to have a very similar event as tonight, but you can ask, you can hear them answer some of the questions that may be more building specific or facilities related. So I did mention, just for those of you who are unaware, we created a special email address called Chatham United at chatham.k12.nyu.us. Myself and others monitor that email address, and we typically try to get back to people not only in anticipation of using those questions for forums like this, but when we can answer you directly, we're doing so. And so keep those great questions, concerns, ideas, and we don't mind the compliments as well, and criticism. So we're open. We're only going to get better if everyone helps us figure out what is going to be best for our students. So with that said, let's go to questions that were submitted. I'm going to pause for just a second and just check with my co-pilots here to see where we are with some questions that we might want to answer. Okay, so I'm going to take a few questions in no particular order, but what options are there for working parents who cannot be home to make their 8, 9, 10, 11-year-old do their remote work? Great question. The only thing that comes to mind in terms of what's different from the spring to now is that they're going to be held accountable for their work. In some cases, they are going to be connected to their classroom for some live sessions. That's going to be up to some teacher discretion. There's going to be homework. There's going to be attendance. And again, doing their work, it's a tough one. But that's, I guess that's the best that I can say. If it's full remote, I can say that if it's not working out, we may have a conversation that they can no longer participate in full remote. We can't have students, falling even further behind. We know that the spring was not ideal, but we are fully prepared to have, as this is kind of an interesting statement, as normal a year as possible, and we want students to be successful. So we would be willing to work with you. If you have concerns, our building principals, our school counselors, our social workers, our school psychologists all have strategies. And again, this is a great place where we want to partner with you to be successful in supporting you and your children with their education. So don't hesitate to keep that dialogue open. So one of our school nurses, thank you. So I want to read this. Students who were on the catch-up schedule last year must be fully up to date on all immunizations by September 8th. No exceptions, no extensions have been granted by the state. So thank you, Mary Noel, for that clarification. I'm glad I didn't, I'm glad you so if you heard me earlier, I wasn't quite sure, but please let me say that again, that whether you're fully remote or in person, we need to have evidence that you are caught up by September 8th, or we're going to have to exclude you from learning that starts on September 14th. So thank you, Mary Noel. Why can't special education students be transitioned into school sooner than October 5th? We're having those discussions, and that very well may be what we end up doing. We've heard that. That makes perfect sense. And that may be one of the things that we change. Our special education teachers have come to us, and that's a very likely probability that our special education students may actually start as early as that second week. So thank you for bringing that up. That's under serious consideration, and that will likely be decided. We were waiting. I'll tell you, we were waiting to make sure that we could do that. We didn't want to do that. We have 4 self-contained special education classes, and we wanted to make sure that we checked with all of those classrooms before we didn't want one doing it and 3 not, or vice versa. And I believe we just got confirmation that that's acceptable to them. And so please hang on. I'm glad you brought that up, but that's serious consideration, under serious consideration, and likely to occur. So thank you. Oh, how will drinking water be available to children throughout the day? Good question. Let me get that answered for you. I have seen similar questions come up. I just don't recall. One of the things is we don't want students using drinking fountains. So in each of our buildings, we have the filling stations. And so likely students are going to be able to fill their bottle. But let us investigate that, because there may be some ways where we also supplement that with some bottled water if we have to. So great question. Thank you for bringing it up. I don't think I've seen that one before here. So that's a great question. What procedures are in place for bathroom use and monitoring? Boy, I've heard the principals working on those plans. Some of that will vary by building and age. In many cases, it'll be individual use, but perhaps escorted. At the high school, we're just going to have to, which I could see is going to be problematic with the number of people we have in the building. But let me put that on the principal's radar, and that's one that we can not only answer in the questions and answer, but we will make sure that we include, if you would make a note of that we can include for Thursday's program as well. But I don't want you to come all the way back. And I know this is a riveting couple hours that you spend with me, but I don't want you to come all the way back for that question. So we will answer that in the frequently asked, or the questions and answers document as well. Can you talk about the plan for traffic as more individual cars are dropping off? Again, boy, isn't that a tough one, right? We all know what MED looked like during a normal drop-off and pickup during the year. I know all 3 principals are talking about using multiple entrances to the building and traffic flow, and that is something that they're working on. And I think we need just a little more time, and then we can come out with perhaps some drawings or illustrations to help parents. Here's where the buses will drop off students. Here's where different grade levels will drop off. I know there's been discussions at the middle school to use different entrances based on grade levels, and so we're a little challenged here physically on campus. We're a little. I think about in terms of some of the parades we had last spring. We do have that path that goes around the MED high school campus, but it is something being discussed, and I'm glad you're putting it, on our radar screen, and we'll make sure that that's addressed for everyone as well before we have everyone back. At the elementary level, do you think that mass breaks every 30 minutes will disrupt learning too much? We're just trying to find a balance. One of the things I said a couple, either last meeting or meeting before, is we want to start off conservatively, and then if we have to, based on our experience, modify something. If we find that that's too disruptive, maybe it's once every hour, maybe it's longer breaks every hour, maybe it's shorter breaks every hour. I think we just don't know, right? We're just using our best but we're using our best estimate as to what might be right. We're going to take feedback from our teachers, from our parents, from our students, and we'll adjust it, right? It really speaks to what I said early on. There has to be some agility, some flexibility in our plans. And again, that's one area where I can see us taking a closer look at. I do want to make sure that I was clear that when the break occurs, we've had discussions in terms of it certainly has to be socially distanced, and when the students are seated and not doing anything in the class, but perhaps as we move forward, I think Kristen mentioned this last time, a little more latitude in terms of flexibility on the teacher's part. Initially, we don't want to have there to be variability. We want there to be, said differently, consistently between classrooms. But as we kind of learn from the opening, it may be that the teacher can have some discretion down the road over when it makes sense in their lesson to do that. We also said, and it was a great idea, a suggestion came from one of our high school teachers, who said maybe that can be combined with some sort of mindfulness activity. So perhaps maybe not deep breathing, but maybe some, affirmations or something that were positive thoughts that we're sharing with the students while they're just relaxing and don't have their mask on. Or maybe it's while they're doing a quiet assignment at their desk. So I'm sure we'll get feedback from our instructional staff as to how that's going, and we'll adjust that accordingly. Let me just move my screen up a little bit here. So I apologize. It seems like your son had not gotten an email to the forums and reminders. The parents did not include the link. You were depending on today's forum to help your son feel more comfortable with returning to school since he's experiencing anxiety. Please reach out to your building principal. That might be a perfect example where we can share a link to the recording. We want to keep that kind of very close. But discuss that with the building principal and have them help you navigate through that process so that you can make an informed decision on that. Where are mask breaks, if it's in the classroom, won't that defeat the purpose of wearing them all day? Well, the way I see it, and I'm no epidemiologist, but a mask is there to try to protect students from emitting respiratory droplets into the air. And you're right. I think to some extent, if they're quietly seated, they're not walking around, they're not spreading those droplets. But I just don't think we see an option in terms of having no breaks. And so they're socially distanced and they're quiet. And that's probably the best scenario to have a break in terms of a mask break, as opposed to, I guess, at other junctures. How will meals be handled during the day? So again, the way we understand it is our food service director, we've purchased some carts that are heated. So meals can be, so students who are bringing in lunch, and I think that was a question last time, can students bring in lunch? Absolutely. Again, if there is a particular allergy in a class, we'll communicate that with parents in the entire class. But assuming that that's not the case, then students who are bringing their lunch would certainly have their lunch with them. And those who would like to purchase or are receiving free and reduced, we will make arrangements, perhaps, and again, I don't know if we've had it worked out. That would be a great question for one of the principals. What we've done in the past, I've seen done in the past, is the classroom teacher takes an order in the morning, and that a student could still order a breakfast or lunch, and that would be delivered to the classroom, and that's delivered in conjunction with those receiving free and reduced lunch. So there's no indication as to who is getting what and who's paying for what and who's not. So they're working on that, but students will, for the most part, be eating in the classroom. Some small exceptions are being considered at the middle school and high school for those who might need to go down to the cafeteria and buy lunch. We've had discussions in terms of removing the cafeteria tables and putting some of the excess desks in the cafeteria that are socially distanced. So if a student had to eat there and they're eating at a desk, we're ensuring that that desk is properly distanced from the next student. So a little bit of that will have to need to be worked out. Are students going to be allowed to purchase milk or ice cream with their lunch? Darn, I hope they're able to buy ice cream. That would be a shame. Yes, definitely milk. I will have to look into the ice cream piece. I don't know if that's practical or not, but certainly we want to really commit to having things be as, I hate using the word normal because it's far from normal, but as close to normal as possible. I think that's going to help us reduce student anxiety, and also I'm thinking in terms of, I've talked to several parents who have had conversations with their students, and we don't want school to be devoid of every reason why students are motivated to come here, right? So as soon as we can have sports and we can have extracurricular activities and we can do things that they are passionate about, that go and support education, that goes for the encore, the subjects as well, right? Art, music, All of those are extremely important to a child's education. We don't want to strip them away. We feel that it would be a travesty. So please know that we are very mindful of that and in making all of our decisions. But as I said earlier, sometimes the trade-offs are very difficult trade-offs, and we're hoping, right? We're all hoping that these trade-offs are short-term, and the faster we can get over this issue, this public health crisis, the better we can kind of emerge and hopefully emerge stronger. For students who are enrolled in remote learning, will meals be provided the way they were in the spring? So the answer to that is they will not be delivered to home. That was a wonderful, and you know, here's a great time to shout out again to all of our transportation folks and all of our food service folks who, in the midst of that whole, you know, March through June crisis, every morning made sure they delivered to those families who needed that. But because our drivers now will be back driving students to and from school, we will have pickup sites like many districts did in the past. If your student is participating in person, and I don't think that was the question, we are going to make arrangements to send students with additional food for those days that they're not here. But for the students who are full remote, we're going to have to work with parents to perhaps pick up what the guidance says is perhaps pick up, I don't want to say bulk food, but you know, perhaps pick up a few meals at a time, a couple times a week. And we will not allow students to go hungry. So if for some reason that is a hardship, I would like you to let the building principals or myself know. And if I have to get into a car once a day, or I have to ask somebody else to get in a car once a day and bring it to somebody who can't get here, we'll do that. But for the most part, it won't be like it was in the spring, where the transportation department has the flexibility to deliver those every day. Can face shields be used in the place of masks? The answer to that is no, not necessarily. So let me qualify that. The way I understand it from the Department of Health is a face shield does not replace a mask. A face shield and a mask is phenomenal protection. But the only exception to that will be for students who we work with their primary care physician, that for some very well-documented medical reason cannot wear a mask. We may have to consider wearing a shield. However, one of the most common, I don't want to say misconceptions, but we've done a little research with some pediatricians. I know a lot of parents who have students who suffer from asthma are concerned about masks, but the pediatricians that we have checked with say that for the most part, students who have asthma who is the word contraindicated, they can wear a mask. That might not be in all cases, but I know that kind of surprised me. It's kind of a little bit counterintuitive for somebody who's not a medical professional. But there's a long answer to a short question. We would only use face shields when masks cannot be absolutely used. And incidentally, we have purchased masks with clear plastic, so that when some of our classroom or some of our students, excuse me, I apologize. Some of our students are receiving speech services or anything where the therapist has to see their the structure of their of their mouth and tongue. We have those, and of course, if we have any students who need to use a clear mask because of lip, what do you call it? For other reasons, we have that. The bus my kids ride is full capacity when they leave in the morning. How will social distancing work? Well, so I've been very careful. We have buses that basically have 44 to 66 passengers. We're not using, I want to be careful about using the word social distancing. Social distancing in my mind is 6 foot away. We're using appropriate distancing, which is basically one student in a seat. We believe we can safely put 22 students on a bus. And that, again, that's another reason, thank you for that question, why we need to know who's coming and who's not Now the transportation department can figure out the routing. We will not put more than the number that we can safely put on a bus. We have a couple contingencies. We do have, we can't get into a financial situation where we're running a lot of extra buses, but we could potentially do some extra runs. So it could be a combination of things. It could be that your bus route is a little different than it was last year because we're balancing out remote and in-person learners. It could be that there's a situation where we make one quick, we make a long run and then we make a quick short run. But the transportation department will take a closer look at that and be able to do that. Is outside learning still being looked at? Absolutely. If you weren't able to join us last time, Kristen explained that in all three of our buildings, we're encouraging teachers whenever possible. They've actually requested it to be outside. We're buying some flexible seating so classes can, individual students will have flexible seating they take with them, go outside, have a class. Kristen even said last time that, please send your students appropriately dressed because as it gets a little chillier, we're still going to try to squeeze out as much outside activity, outside learning as possible. We do have some of our wireless signal reaches out a little bit past our building, so wherever teachers can take advantage of that and isolate themselves around the campus, we will do that. I'm concerned about the stated exclusion of hand sanitizers in school. Will these be prohibited prior? Were these prohibited prior to COVID? It's unclear. I didn't go back and look back. Like I said in the last meeting, a lot of times kids have the hand sanitizer hanging off their backpack. At one point in the past, alcohol-based hand sanitizers were not allowed in schools because they were combustible. The non-alcoholic ones, which my understanding, Andy mentioned this the last forum, are not as effective, but they technically were not allowed in the building. That has been relaxed this time around because we know that 60 or 70% alcohol hand sanitizers are needed to be effective on COVID. So to some extent, they probably were prohibited. I'm not so sure we paid close attention to that. And you've heard my explanation in terms of why we want to provide the hand sanitizer here so that we can know that it's not one that's been recalled, it's the proper formulation, and to the best extent, it's not fragranced so that it doesn't affect anybody's asthma or allergies. For students that play intramural that requires them to use a mouthpiece, will they be allowed to do so since the requirement to wear a mask? The principals and music staff are working together to ensure in music classes, and we'll update students and families when everything is in place. I know just before this started, I have a couple music experts in my room here with me, and they were noting some of the new protocols that are coming out in terms of playing instruments and the types, the types of masks that are now available for musicians. So interesting, but let me assure you that our staff is on top of that, and we'll make sure. I'm sorry, did I say intramural? I meant instrument. I'm sorry, I think I misread that. For students that play an instrument that requires the use of a mouthpiece. I guess I was thinking like sports mouthpiece when I saw that. But yes, I did answer the question the way it was intended, and that is our music staff is looking into that. And our music staff here, if you've been part of our program, they're not going to let you down. Can you give a little more detail on the first 2 weeks of remote learning? Will children be required to log on at a certain time, or can access be done anytime during the day after parents get home from work? So right now, teachers are working in subgroups this week. There's one subgroup there's a couple subgroups specifically related to instruction at different levels. I think there's going to be a combination. I'm not trying to skirt your question, but we do think that some of it will be, we want to have some of it be live where the teacher is checking in and introducing themselves and working with the students, and some will be what we call asynchronous or not live activities. pre-recorded or live instruction expected in MED level. I'm not sure if you're talking about the full remote option, the way we envision it as I sit here today in front of you, is that because we're going to dedicate a specific resource to full remote, that teacher is going to be engaged quite a bit of the day live with those students at home. Not to say that perhaps she'll give them a lunch break or a bathroom break. That was an interesting question I heard today from the student forum. If I'm fully remote and I have to use the bathroom, how do I do that? Well, you raise your hand and ask the teacher, let her know, or you text Chatter. I'm gonna step away. That may be different at different age appropriate levels, but we're gonna have to work through this. Some of this is new to all of us, so I'm sure by the first week or two, we're gonna know what that looks like. So has the school been able to purchase more air conditioning units or fans for classrooms? The answer to that is no. We haven't. I don't believe there's any additional air conditioning units than what we had last year. And my understanding is fans are now. And I want to go back and make sure that Andy answers that appropriately. But I think fans are no longer allowed because that is going to spread the aerosol much quicker within the classroom. So I want to verify that. Don't quote me on that one. We'll get more on that. But I don't believe fans are allowed in here. That's an interesting point too. One of the other benefits that someone who is in favor of the new opening plan said to me is that, boy, that's going to be great. By the time the students come back, it typically might be after what we refer to as Indian summer. Those first few weeks in September can be brutal at MED and some of the classrooms at the middle school. So we may very well be addressing another issue that we really a positive outcome of delaying kids being back in school for those 2 weeks. And certainly by that last week in September and the first week in October, it may actually be much more tolerable. Maybe not a primary reason to delay the opening, but certainly an added benefit. Will the elementary art, music, and library teachers be moving from classroom to classroom to teach at MED? I'm going to also divert that to Kristen. I know they're working on that. Remember, our primary goal is to not have, a Department of Ed or Department of Health nurse on Friday's call with the nurses says, what if that teacher is a super spreader? And now we've done all this hard work to keep kids, in pods and in classrooms to the extent that we can, and then we have a teacher going between rooms. So perhaps that teacher might go into those classrooms via, remote or some other strategy. But I'm going to ask Kristen to weigh in on that, on both the questions and answer document, and then perhaps touch upon that at the next town hall as well. Let me circle back around here. Has there been more discussion about students that have 504s or need 504 plans and how they will transition back to school? Any parent who feels that a 504 might be needed should contact us. If you've dealt with Lucas in the past, please reach out to him. We will evaluate each situation individually, but certainly the 504 is an accommodation. And if we need to accommodate students during this transition, we will certainly entertain that. So don't hesitate in like a lot of these my answers. If you find that they're confusing or not complete, and you're not satisfied, drop me an email. I encourage you. Your building principals are wonderful. Your building assistant principals are wonderful resources. So please don't hesitate to reach out to them. Whether it's an email or even just pick up the phone. That's always encouraged. Can children take turns in mass breaks? If they do, can the children take turns in mass breaks if they do it in the classroom? That way it won't defeat the purpose of wearing the mask. You know what? Thank you. So for the purposes of everyone listening, it may be in alphabetical order or two at a time in opposite sides of the classroom. I don't know. Great idea. It's only through your ideas and feedback that this is going to get even better. The plan's going to get even better. I didn't give that much thought, but we have an administrative meeting tomorrow, and I will certainly share that. And if that has some merit, maybe that's worth considering. So thank you for bringing that to our attention. I think I have one more new question. And then is that the last one for tonight? Well, like, I'm with you to as long as you want me to be here, but I'm leaning towards a fully remote option for my children, but I would like to make that decision closer to school as these forms continue to see if I leave it as I'm going to in-person, will I have the option to switch to remote learning if it looks like COVID is spiking in the county or I feel uncomfortable with the plan? So I'm gonna answer that the same way I've been answering it, right? Vaguely. Now, so here's the thing. We needed to know if you wanted to commit to remote instruction because we can't make plans without it. However, if you choose in-person, like I've said multiple times, and something happens where we aren't forced to go remotely anyway, we're willing to have that conversation with you, and as long as we can accommodate you, we're here to do what's best for the kids. So the answer to that is a firm maybe, but likely. And I'm not sure, maybe I am being a little facetious, and I apologize. But again, we're willing to entertain, and if you're feeling uncomfortable, we don't want people that have heightened anxiety over a situation. So I hope that answers your question. And again, any time during that process, pick up the phone, talk to the principal. If you're questioning something that you're unsure about a practice or a procedure and need more information to feel comfortable about what we're doing here, don't hesitate to let us know. Yes. Okay, we got a couple more. If a student begins remote learning and is moved back into the building during the next grading period, will they be placed into the classroom they were originally put in? So the answer to that is no. And so let me try to, it depends on, actually it would depend on grade level. At NED, likely not. As I mentioned earlier, we are probably going to have remote only specific sections. So hypothetically, I'll use fictitious names. You're in grade 5 and there's 3 grade 5 sections, and you're in remote only with Mrs. Jones, and the next semester you come into back to school, you would no longer be in Mrs. Jones' remote section, you may be in the in-person section, so you may be switching teachers. But you asked about the grading period, so maybe you're referring to 7 through 12. So that's where it's likely that the classroom teacher, the student is going to be assigned to a teacher's caseload, and in the 7 through 12, it's more likely that whether you're remote or in person, you are going to have the same teacher. So I think it's safe to say that K5, K6, I'd have to check with Mr. Burns at the middle school on 6th grade. K5, the answer to that's likely not. 7 through 12 likely is, and 6th I have to check in for you. Another question, my child will be attending Questar 3 in the fall. Questar is planning on having in-person 5 days a week. Though Chatham, my student, will be an AV schedule. How does this work getting my child to Questar daily to attend classes? Again, I said that, I answered that a little bit earlier in the context of my presentation. That is one of the agenda items that we are discussing tomorrow at an administrative meeting. We're trying to figure that one out. If we had the adequate space, I think the most logical answer is that if they're attending Questar 5 days a week there, when they come back, they would attend here. We're just bumping into that one limitation of capacity. We can't bring half the number of students back on any given day, and also our special education students and our Questar students. Let me ask that. That will be up probably just before school starts, right? Yeah. Yeah, the new one. Okay, so will the daily, a new one came out, will the daily self-assessment be on the school website? No, the parents parents will get a daily email or SMS to respond to. And it's a quick little form, and that new system is tied to our student information system. So if you have 3, and it's by what we call household or census, if you have 3 children, regardless of names, if they're tied to you as a primary contact, I'm saying that correctly, I think, you will get 1 email or 1 SMS that says, here's the link to today's self-assessment. You won't have to go to a link on the website to do that. That'll be emailed to you each morning. And before school starts, we will have to make sure that parents update that information to make sure it's accurate. Now, the worst case that happens is if you miss that, and again, that's, if you remember from the beginning, I said that's one way that you can immensely help us to get kids into the building and minimize the loss of instruction time as we process kids. Because for those kids that don't do the self-assessment, we're going to have to redo it here. So we certainly appreciate if parents do that. And I think I'm right. Okay.
Those other questions are leftovers from before.
Yep. I'm just looking at a couple from last week to see if there's some in there that might. Can I provide my child's transportation to and from Questar 3 to avoid extra contact as SHS? Absolutely. Not only can a parent do that, but we have some students who actually become, get their driver's license and have a vehicle. It's not uncommon to see students drive back and forth to whether it's the New Visions program or even the Questar program. And, can I answer that one? So the tomorrow, next couple of days, we are going to be firming up our learning support option. And as soon as we have that hammered out, we might actually have to do a survey to see how many people are interested in that, because we need to do some proper planning, and then maybe a commitment will follow that. We need to think that process through. So don't be surprised that if in the next couple of days we reach out and say, we'd like to offer this during the full remote weeks, but to build a program and to better understand the transportation needs, would you take, in the next couple of days, take some time to understand if you would be taking advantage of that? Should it be, and when we make it available? And if so, that will give us a sense for what we need to build. And then when we get maybe a little bit closer, we would ask parents to actually sign up for that. That's how at least I can envision that before we talk with the administrators tomorrow. We're good? So I'm gonna say last call. It's 7:42. We've now answered all of the questions that have come in this evening. If you, my mom would say, speak now or forever hold your peace. God bless her. She's 92, and I more times than not hear myself repeating things she said to me, and I've learned to not question some of the early lessons that she taught me that I didn't necessarily appreciate when she was telling them to me. I'm going to say that's it. We will process this video, as I said earlier. We will, let's see, we did the questions there, and I always forget to run this slide. So 2 things in closing. Thank you to the entire staff here at Chatham, those working, teacher leaders, those working on the subcommittees, our parents who've been wonderful in terms of sending us ideas. This recording will be processed and will be on the website by later tomorrow afternoon, so please share it with those who couldn't join us tonight. And one last reminder, we'll be back at it Thursday night with the principals and the director of facilities. Again, the format we're going to use that night is to do a little bit of an overview for those who it may be their first time, and at that point I should have perhaps even some new information on the learning support that will be coming out, and any other questions that come up between now and Thursday. I thank you. I just see a couple people use the questions and answers to thank us, and from my heart, please know the administrators, everyone here is just working tirelessly to try to figure this out. And I know some of you may be frustrated. Sometimes things came out a little bit later than we'd like. We have an obsession to want to try to not put anything out until it's been, vetted and thoughtfully considered. And sometimes that takes time. And I appreciate that. And again, I'm just going to say blanket, if you have any questions, please reach out to the principal. Please reach out to me. Good evening, folks. Stay safe, stay well. We'll talk to you soon.